Hi, my name is Scott Yaris from Michigan State University and Stuttering Therapy Resources. I'm here with just a quick update on some research that one of my colleagues, Dr. Seth Tishner, and I did and published in the American Journal of Speech Language Pathology a couple of years ago now. This work was on repetitive negative thinking in adults who stutter. First, let me tell you about why we do this work. One of the things that we're interested in my lab is trying to understand how individual differences between people who stutter might contribute both to their experiences in life and to their experiences in therapy. You know from your own clinical experience that different people have different experiences in therapy. Some people come into therapy and find it to be quite successful for them. Others come into therapy and struggle a bit more and don't find it to be as successful for them. Of course, that's true about any condition for any therapy. But one of our areas of focus in my lab is trying to understand how individual differences between people might contribute to how they succeed in therapy. Are there some people who, because of who they are more likely to gain greater benefits from therapy, and other people for whom we might need to adapt therapy in order to help them achieve their goals? It fits into the overarching belief that stuttering is heterogeneous condition, that people who stutter are different from one another, and that there is no one therapy approach that works for everyone. That's true just because stuttering differs across people, but it's also true because of the individual differences that people who stutter bring to the table. And so we have been looking at a variety of different individual characteristics that can help us understand people's experiences. In this study that I'm talking about, published in AJSLP, we were specifically looking at what's called repetitive negative thinking, or you might know it by the name rumination. Rumination is a tendency to think repetitively, repeatedly, about things that have happened to you, or about ideas, or about feelings or concerns. And sometimes we can think repetitively about things in a positive way, being really happy about something. Though some of us tend to think about things that are negative or that we perceive to be negative in a repetitive way, chewing over them. That's where that term rumination comes from, worrying about them and dwelling on them. Well, the first question we asked is, are people who stutter more likely to experience rumination than people who don't stutter? Is this a characteristic of people who stutter? Our hypothesis was that it would not be, because there are very few things that all people who stutter do and all people who don't stutter don't do. And indeed, we did not find that people who stutter exhibit a tendency toward rumination at a higher level than people who don't stutter. Okay, we expected that. But what we did find, and this is exactly what we were looking for, is that people who tend toward rumination, they tend toward engaging in repetitive negative thinking, they actually experience greater adverse impact as measured on the OASIS than people who don't tend toward rumination. Now, there's more covered in the study than just this one finding on repetitive negative thinking, but this is an important one. Because research from psychology shows that if a person engages in repetitive negative thinking, you can help to reduce the impact of their condition, whatever it is. We're talking about stuttering, of course, but in psychology, they're talking about anxiety, depression, other major life impact conditions. And you can reduce that impact. Not just by focusing on the anxiety or the depression, sure, but by focusing on the tendency to engage in repetitive negative thinking itself. This is important for us in stuttering therapy. It doesn't mean that all people who stutter need work on repetitive negative thinking. It means that if your client does experience rumination, if they do tend to dwell on their negative experiences with stuttering, then we can help to reduce the burden and the impact of stuttering on their life by focusing on the RNT itself, regardless of what happens with the fluency. They may and probably will continue to stutter. They may and probably will continue to have negative experiences associated with stuttering. But if we can help them learn to change their tendency toward repetitive negative thinking, then we can reduce the impact of stuttering on their lives. In a future video, I'll talk to you about how we change that repetitive negative thinking and some of the other findings from this study, but you can find it in American Journal of Speech Language Pathology in 2019, Repetitive Negative Thinking, Temperament and Adverse Impact in Adults Who Stutter by Seth Tishner and myself. Thanks for listening to this brief little research update from Stuttering Therapy Resources. You can find a lot more of our work online, www.stutteringtherapyresources.com, or on the social media outlets. We're at Stuttering Therapy Resources. Thanks.